Good evening and welcome to another episode of the CHERS Podcast, Center for Health Education and Research of Switzerland. Tonight, we explore a theme that is increasingly central to how we live, learn, and stay healthy: digital health literacy. Because let's be honest, today, health information isn't just shared in clinics, classrooms, or community centers. It's on TikTok. It's buried in search results. It's streaming on YouTube. It's flooding WhatsApp groups. And often, it's wrong. In a world shaped by algorithms, misinformation, and digital inequities, how do we prepare people to find, evaluate, and use digital health information wisely? How do we ensure that digital innovation promotes, not undermines, health equity? Let's dive in. So let's start by asking a deceptively simple question. What do we mean when we say digital health literacy? Because if we don't define the problem clearly, we're at risk of solving the wrong one. Now, most people, when they hear that phrase, imagine someone typing symptoms into a search bar: headache on right side, natural remedy for cough, what is a silent heart attack? And in a way, that's not wrong. But if we stop there, we're profoundly underestimating the complexity of the digital world we live in and the skills required to survive in it, let alone thrive. Digital health literacy, sometimes referred to in the literature as e-health literacy, is not simply about having access to Google or being able to open a medical app. It's about the ability, the empowerment to seek, understand, critically appraise, and appropriately apply digital health information in a way that supports sound decision-making for yourself and sometimes even for others. And here's where it gets interesting. Digital health literacy isn't one single skill. It's actually a convergence, a multi-layered, interdependent construct built from several distinct but interwoven literacies. Let's unpack those. First, we have traditional literacy, the foundation. This is the basic ability to read and comprehend language. But in health contexts, this gets complicated quickly. Because it's not just about decoding letters on a screen, it's about grappling with specialized terminology, probabilistic thinking, risk percentages, and sometimes ambiguous or evolving scientific claims. Ask yourself, what does 95% vaccine efficacy really mean to someone with limited numeracy? Or how do you interpret a statement like, no statistically significant benefit was observed? You need more than just reading skills, you need critical reading skills. Second, we add information literacy. Now we enter the realm of judgment. How do you find reliable health information in the first place? More importantly, how do you know if it's trustworthy? Can you distinguish peer-reviewed evidence from anecdotal opinion? Can you tell whether a website is run by a medical association, a for-profit supplement company, or a conspiracy forum posing as wellness advice? The digital information environment is not neutral. It's algorithmic, opaque, and often driven by engagement metrics, not accuracy. So having information literacy means being skeptical without being cynical, curious without being naive. Third, let's talk about media literacy. This is where we shift from what is said to how it's said and why. Can you recognize when information is framed to provoke fear or sell a product? Can you identify visual cues that imply credibility, like white coats, stethoscopes, or scientific-sounding language, when in fact the content may be misleading? Media literacy also means understanding the politics of platforms. Why does one video go viral while another, more accurate but less sensational one, gets buried? Whose voices are amplified and whose are silenced? It's not just about content, it's about context and power. Fourth, we layer on health literacy. This brings us back to the person. Can you apply what you've learned to your own health context? Let's say you understand an article about hypertension. That's good, but can you translate that knowledge into action? Can you manage your medications, adjust your diet, ask informed questions at a doctor's appointment? Health literacy is about self-efficacy and navigation, not just of information, but of health systems. And finally, the digital layer itself, digital literacy. This includes the skills to navigate interfaces, use mobile apps, schedule telehealth visits, access electronic health records, and protect your privacy and data. It's one thing to find a reliable article. It's another to use a chatbot symptom checker responsibly, interpret your fitness tracker's metrics, or troubleshoot a patient portal error during a crisis. So we see that each of these literacies is necessary, but none is sufficient alone. True digital health literacy exists only at the intersection where these skills converge, interact, and reinforce each other. And that intersection is where the real educational challenge lies. Because improving digital health literacy isn't just a matter of giving people access to the internet or handing them an app. It's about nurturing critical thinking, contextual understanding, and above all, agency. As educators, clinicians, and health promoters, our job is to make sure that people are not just recipients of digital health content, but competent, confident navigators of the digital health landscape. And perhaps more provocatively, we need to ask, are we preparing professionals to educate patients in this landscape? Because digital literacy is no longer optional. It's not a luxury skill. It is the new baseline of public health in the 21st century. Let's not sugarcoat this. When we get digital health literacy wrong, the consequences aren't theoretical. They're devastatingly real. And recent history has offered us a masterclass in just how high the stakes can be. We saw this with striking clarity during the COVID-19 pandemic. While virologists, epidemiologists, and public health leaders scrambled to communicate evolving science with nuance and care, a parallel and far louder narrative was already in motion. Claims that masks were harmful, that vaccines altered DNA, that 5G towers were somehow causing viral spread, that drinking bleach or taking horse dewormers might offer a cure. These weren't fringe beliefs confined to conspiracy corners of the web. They were mainstreamed, algorithmically boosted, and, in some cases, politically weaponized. And the data backs this up. Studies published in the Lancet Digital Health and Nature Human Behavior demonstrated clear correlations between exposure to health misinformation online and measurable changes in public behavior, increased vaccine hesitancy, reduced compliance with mask mandates, delayed or avoided medical care, and yes, even COVID-related mortality. What we witnessed wasn't just a communications breakdown, it was a full-scale public health crisis, fueled by information disorder, and that crisis hasn't ended. It's simply shapeshifted. Even beyond COVID-19, the digital ecosystem continues to amplify harmful health narratives. We see it in the realm of mental health, where stigma is reinforced by poorly contextualized content or moral panic headlines. We see it in cancer treatment, where desperate patients are lured into expensive, unproven, and sometimes dangerous alternative therapies. We see it in chronic disease communities like those for diabetes, hypertension, or autoimmune disorders, where charlatans exploit fear and frustration to sell supplements, pseudoscience, or conspiratorial ideologies. And here's the critical point: the harm is not only in the falsehoods. It's in the erosion of trust in science, in clinicians, in institutions. It's in the fatigue and confusion created when people can no longer distinguish credible guidance from calculated disinformation. And it's in the social fragmentation that occurs when health becomes a battlefield of identity, belief, and ideology. Now some might argue, well, just correct the misinformation, provide better facts. But the evidence tells us that information alone doesn't change behavior, especially in the digital environment. Why? Because people don't just consume information, they interpret it through filters of identity, emotion, community, and lived experience. That means effective health promotion in the digital age must go beyond fact transmission. It must engage emotionally, culturally, and contextually. It must acknowledge power asymmetries in who produces knowledge and infrastructural disparities in who accesses it. And here we must confront an uncomfortable reality: access to accurate, comprehensible, and culturally resonant health information remains starkly unequal. Underserved communities, whether due to language barriers, low literacy, limited digital access, or historical marginalization, are often excluded from the benefits of digital health innovation. Older adults may lack the technological confidence to use digital tools effectively. People in rural areas may face bandwidth issues, while immigrants may encounter platforms that don't accommodate their language or cultural references. This is what we mean when we say digital health literacy is a social determinant of health. So, the challenge before us is not simply one of correcting bad information. It's about designing systems, strategies, and educational approaches that empower people to discern truth in a chaotic digital environment without privileging only the digitally fluent or the formally educated. We must ask, how do we create health promotion campaigns that resonate in TikTok culture but retain scientific integrity? How do we equip community health workers with the skills to combat digital myths in WhatsApp groups? How do we include elders, migrants, low literacy populations in the digital health ecosystem as informed participants, not passive recipients? Because if we fail to address these questions, the digital divide becomes a health divide. And if health education doesn't evolve to meet people where they are, screen in hand, algorithm at play, distrust in the background, we will continue to see public health crises born not of pathogens, but of information itself. Now that we've unpacked what digital health literacy is and why getting it wrong can have serious, sometimes tragic consequences, the natural next step is to ask, how do we fix this? How do we build digital health literacy in the populations that need it most? The answer, unsurprisingly, is complex, multifaceted, and requires systemic change. But I want to highlight three critical arenas where progress must happen, each reinforcing the other: the training of healthcare professionals, community-based public health education, and the education of our youth. First, we have to start with healthcare professionals themselves. It might seem obvious, but it's worth stating. Doctors, nurses, allied health workers, if they lack digital health literacy, they cannot effectively support their patients in navigating the digital information ecosystem. This is not just about being savvy with technology or even about knowing the latest clinical guidelines. It's about being able to critically assess the quality of digital content, recognize when patients are influenced by misinformation, and communicate health advice clearly in a digital context. Imagine a clinician faced with a patient who's read a dubious blog claiming that a prescribed medication causes cancer. What does the clinician do? How do they validate the patient's concerns without dismissing them? How do they guide the patient toward reliable online resources, not just authoritative websites, but culturally and linguistically accessible platforms? Some medical and nursing schools are responding by integrating concepts like digital professionalism, critical appraisal of digital content, and digital communication skills into their curricula. This is promising, but the reality is uneven. Many programs are still stuck in traditional models, teaching clinical skills that assume an offline world. It's time to move beyond that. Healthcare education must embed digital health literacy as a core competency because patients expect and deserve providers who can guide them in this new terrain. Second, let's talk about community-based digital literacy programs because the digital divide is not just about geography or age, it's about culture, language, and trust. Public health educators and community organizations play a vital role here. They are uniquely positioned to develop tailored interventions that meet people where they are. Examples abound. Digital literacy workshops offered in local libraries or community centers provide hands-on training for older adults or underserved populations. These aren't generic how to use the internet classes, they're focused on health content, how to find credible information, recognize misinformation, and use telehealth services. Then there are mobile apps designed with local languages and simple visuals to overcome literacy barriers. Apps that do not assume English proficiency or advanced reading skills are much more inclusive and effective. Video campaigns on platforms people actually use, WhatsApp groups, YouTube channels, Instagram stories can leverage storytelling and culturally relevant messaging to break down complex health concepts into digestible, relatable formats. And here's a particularly innovative approach: collaborating with community influencers or microeducators. These are people who already hold trust and credibility in their communities, not official health authorities, but neighbors, local leaders, or content creators with authentic voices. Trust is critical. No amount of scientific accuracy will resonate if the messenger is perceived as distant or out of touch. Third, we must confront a common misconception. Young people are digital natives, so they automatically know how to navigate digital health information responsibly. The truth is far more sobering. Being born into a world saturated with technology does not guarantee the ability to critically evaluate content. Teenagers, just like adults, are susceptible to misinformation, sensationalism, and peer pressure. In fact, social media platforms like TikTok, Reddit, and Instagram, where many young people turn for health advice, often blur the lines between entertainment, opinion, and evidence. This makes it essential to embed digital health literacy within secondary education curricula. Critical thinking, fact-checking skills, media literacy, and understanding of bias must be taught explicitly, not assumed. We need to equip youth with the tools to question what they see, seek multiple sources, and understand the stakes behind misinformation. They must be empowered to not only protect their own health but also become informed digital citizens who can contribute positively to the online information ecosystem. As we consider the broad challenge of digital health literacy, it's encouraging and instructive to examine some concrete examples where innovation is meeting this challenge head-on. Around the world, diverse initiatives are emerging that blend technology, pedagogy, and cultural insight to make a real difference. These efforts don't just push apps or websites, they embody a deeper commitment to equity, relevance, and trust. Take Finland's eHealth literacy program, for example. Here, the focus is on the youngest learners, primary school students. Rather than waiting until they're adults or in healthcare professions, Finland invests in early education about evaluating online health information. Children learn to ask fundamental questions. Is this source credible? Is the evidence peer-reviewed? Who stands behind this claim? Embedding these skills early fosters a generation that can critically navigate an increasingly complex digital health landscape. Moving to India, the Arajaya Setu app exemplifies a massive, practical intervention at scale. During the COVID-19 pandemic, this app wasn't just a tool for contact tracing, it became a platform for integrating culturally relevant health promotion messaging to over 100 million users. The app delivered timely information on hygiene, symptoms, vaccination, and government protocols, demonstrating how digital tools can harness scale and immediacy for public good. On a global level, the World Health Organization's Be Health Literate campaign provides invaluable digital toolkits designed to improve the accessibility, clarity, and credibility of online health content. This initiative highlights the importance of standardized, evidence-based resources that can be adapted to diverse linguistic and cultural contexts. It's a reminder that global health promotion in the digital age requires coordination and shared standards while respecting local nuances. And innovation isn't limited to high-tech apps or international agencies. In communities across Brazil and South Africa, community health workers leverage mobile video and WhatsApp voice notes to reach populations with low literacy and limited internet bandwidth. These tools transform familiar, accessible platforms into powerful conduits for vaccine education, prenatal care advice, and chronic disease management. It's a vivid example of how local knowledge and simple technology converge to overcome barriers that traditional health promotion methods often fail to address. These initiatives, whether targeting children in Finland, millions in India, global audiences through WHO, or marginalized communities in Brazil and South Africa, share a common thread. They recognize that digital health literacy isn't just about information access, it's about designing education that is equitable, culturally responsive, and grounded in trust. So, what do these lessons mean for us, whether we are educators, clinicians, public health promoters, or simply engaged citizens? They call on us to rethink who our learners really are. It's no longer just the students sitting in classrooms or the patients in clinic waiting rooms. Our learners now include communities, parents, elders, adolescents, and even digital bystanders, all navigating an ever-expanding sea of digital health information. Often contradictory, sometimes misleading, and frequently overwhelming. We must also rethink what we teach. The traditional emphasis on clinical facts and guidelines remains vital, but it's no longer sufficient. We must also teach how to discern quality from noise, how to engage in respectful dialogue about health beliefs, and how to make informed decisions amid uncertainty and complexity. And perhaps most profoundly, we must rethink where and how we teach. The future of health promotion is no longer confined to hospitals, community centers, or lecture halls. It's taking place in real time on news feeds, in group chats, behind search bars, and through the endless scroll of social media. In this contested information landscape, credibility is hard-won and easily lost. Our challenge is to meet people where they are, using new platforms, new voices, and new pedagogies, while upholding the rigor and empathy that public health demands. The frontier of health promotion, then, is digital. It's messy, it's dynamic, it's contested, and it's absolutely critical, because the future of health, our individual and collective well-being, depends not only on what we teach, but on our ability to teach meaning itself in a digital age where answers are just a click away, but understanding requires so much more. Thank you for being part of this conversation on the CHERS Podcast. If this episode resonated with you or sparked new ideas, please share it with your networks, rate it, and subscribe so you don't miss future discussions. And remember, health promotion begins with asking better questions, even when the answers seem just a click away. Until next time, remember to subscribe to receive information when a new podcast is published. Be well, stay critical, and keep learning.